Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Friday, February the 12th. Honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh people. Honored to be here on their lands today. Dr. Henry and I will be briefing again next Tuesday, which is February the 16th, from the Press Theatre in Victoria. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. And a happy Lunar New Year's to everybody. Gong hei fat choi to everyone. For today, we have 445 new cases that have been diagnosed with COVID-19, 6 of whom were epidemiologically linked cases, bringing our total number of people with COVID-19 in British Columbia to 72,750. Of the new cases, 135 are people in the Vancouver Coastal Health region, 218 are people who reside in the Fraser Health region, 15 are in the Vancouver Island Health region, 44 people live in the Interior Health region, and 30 are in the Northern Health region. In addition, we have 3 new cases in people who normally reside outside of Canada. We now have 4,347 active cases across the province, of whom 226 people are in hospital, 61 of whom are in critical care or ICU. And an additional over 7,035 people continue to be under public health monitoring, with 67,008 people now recovered from COVID-19. Again today, unfortunately, we have 10 new deaths to report of people, mostly seniors in long-term care, who've died from COVID-19, bringing the total number of people in British Columbia to 1,288. Our condolences go out to the families and the care providers and the communities who have lost their loved ones during this very difficult time. We have 1 new healthcare outbreak in an assisted living facility, the Chartwell Carrington Place, where we have a single staff member and a single resident affected so far. And 2 outbreaks have been declared over at the University Hospital of Northern BC, where there were several units where had outbreaks, and at the Royal Columbian Hospital. And I do also want to note one of the outbreaks, one of the more tragic outbreaks that we've had in long-term care at the Jubilee Lodge in Northern Health was finally declared over yesterday, and our thoughts are with the community in that facility. We now have 16 active outbreaks in long-term care and assisted living and 6 in acute care units involving 541 residents and 344 staff. In addition, we have a new community outbreak in the Bruce Jack Mine in Northern Health. Since the start of our immunization program, we're now up to 162,982 doses of COVID-19 vaccine that has been administered in British Columbia, and of these, 17,562 people have received 2 doses of the vaccine. As we know, in the past couple of weeks, we've had very limited vaccine supply, but thankfully, starting next week, deliveries of our Pfizer-BioNTech vaccine will start to resume at much higher levels, and we expect to have a significant bump in supply in the coming weeks. This will allow us to fully resume our province-wide immunization program, focusing, as we have been in phase 1, on those most at risk of having severe illness or dying, and people who are in the front lines of our healthcare system. And we're very excited that we're going to be ramping that up in the next few weeks. And very soon we'll be able to expand into the community groups, particularly our seniors and elders. As I'm sure many people have noticed, we've also seen a notable decrease in transmission and outbreaks in long-term care and assisted living facilities as immunization has rolled out. And this is clear evidence of the effectiveness of the vaccines and extremely encouraging news, and I know a relief to everybody who has family members in care homes. As new cases continue to decrease in long-term care, we also need to continue to decrease our transmission in our communities. We are trending in the right direction, pushing our curve down, but slowly, and we need to ensure our success sticks. This means staying the course with our layers of protection and continuing to follow all of our public health restrictions and guidance. This weekend, we need to pay particular attention to ensure that the progress we have made is not wasted. And I think Mother Nature is going to be on our side there, where it's going to be a challenging weekend for many people to travel. This is even more important as variants of concern that we've talked about are circulating in our community. To date, we've had a total of 46 confirmed variant cases in British Columbia. 29 are of the B117, or the originally found in the UK, and 17 of the B1.351, originally associated with South Africa. In the past week and a bit, the BC CDC lab, in conjunction with our provincial labs, have been doing ongoing surveillance to help us better understand how many of these variants of concern, people infected with these variants of concern we have in the province. And they did what's called a point prevalence assessment, where we screened every positive case between January 30th and February 5th with a marker to see if they might contain this variants of concern. And of 3,099 positive cases that were screened, there were 3 that were confirmed by whole genome sequencing to be variants of concern, one of which was a South African associated variant, and the other 2 were from the UK. So this is reassuring. It tells us that we don't have high levels of transmission in our communities, but that we still need to be cautious and continue to monitor. In addition, in the past week, we've identified another variant that is under investigation internationally and across Canada. We've had a single case of this variant. It's been associated with Nigeria and traveled to Nigeria. And the single case that we've had here in British Columbia was a person who had traveled to Nigeria. And it's being labeled the B1.525 variant, so it's a new one to add to our lexicon. We aren't entirely clear yet whether this variant also has increased transmissibility or causes more severe illness, but our lab team is working with their counterparts across the country and internationally to get a better understanding of what this can mean. The emergence of these variants, of course, makes us all concerned here in BC. They've shown in many places around the world that they do confer an advantage in that these viruses tend to spread more quickly, and now more evidence that they might cause more severe illness. As we have seen, the choices that we make today, as well as the plans we make for tomorrow, make a difference to all of us. We are in some ways playing catch-up with this virus, and breaking those chains of transmission, preventing that next infection, is what we need right now to buy us that time to get our immunization programs back up to speed again, and to help us give that protection buffer against these new variant viruses that are emerging around the world and here in BC. I know so many people in British Columbia are doing just that, doing their part every day. And you've chosen things like fewer faces and fewer places to keep your local community, your family safe. I know you'll be doing the same this long weekend, and I am so appreciative of that. Thank you to everyone. On this first day of the Lunar New Year, it's a time to reflect on the challenges that we have overcome since this time last year and the progress that we have made. It's also our time to look to our brighter days ahead. I hope everybody has an enjoyable Family Day weekend, and please remember to be kind, be calm, and to be safe.
Thank you very much, Dr. Henry, and I want to join Dr. Henry and on behalf of the Premier and the government, really the people of BC, to pass on my condolences to the families, the friends, the caregivers of the 10 people who passed away from COVID-19 in the last 24 hours in BC, many of them in long-term care as we deal with outbreaks that occurred in long-term care in November and December and January that are ongoing. I wanted to note that we have 226 people currently diagnosed positive for COVID-19 in acute care hospitals across BC. That 61 of those people are in ICU at present. And if we look at the overall hospitalization rate for obviously COVID-19 and all the other things that that bring people to hospital, our base bed occupancy rate is 90.3%, leaving us 910 empty base beds in our hospital system. 72% occupancy rate amongst all beds. That includes the significant number of surge beds that were added to prepare for COVID-19. That leaves 3,337 beds. In ICU, our occupancy rate is 77.1%, which leaves 122 ICU beds available for new patients that are effectively empty at present. And our occupancy rate, including ICU surge beds, is 54.7%, which is 344 additional beds that are currently vacant. So that situation continues as it has been. That doesn't mean that, especially in hospitals in BC, such as St. Paul's, such as Royal Inland, there aren't profound stresses as there are in all of our hospitals as a result of COVID-19. But we continue in our acute care sector to have the ability to manage that. Dr. Henry talked about the 162,982 immunizations that have taken place in BC, including 17,562 who received both doses. As Dr. Henry noted, that we are expecting over the last 3 weeks, we've received about 21,000 doses of the Pfizer vaccine over 3 weeks. And next week, we are expecting to receive considerably more, according to the federal government, 54,990. And obviously, because we're doing both first and second doses, and because of the interval, a majority, about half of the Pfizer immunizations in the coming week will be second doses. And most of the Moderna, which has also been slowed, as all of you will know. But what we're hoping to do and continue to do is continue to now complete second doses in long-term care. And Dr. Henry has spoken about the extraordinary success of immunization in long-term care in BC, and we want to acknowledge everyone who is part of that effort and obviously move on there to second doses, and that is what's happening. So those are that gives you a sense of what to expect. In this briefing every week, we bring you up to date on progress on our surgery renewal commitment. As people will know, non-urgent surgeries were cancelled now on March 16th to May 17th in BC. The health authorities resumed non-urgent surgeries on May 18th and have completed a total of 244,245 surgeries as of February 7, 2021, of which 191,120 were urgent and non-urgent scheduled surgeries, and 53,125 were unscheduled or emergency surgeries. With each week we build on these achievements. Our surgical renewal progress shows what is possible when we come together as healthcare providers, administrators, and community members, and I, for one, am grateful. And with that, here's the latest weekly report. The total surgeries completed by health authorities since May 18th. It's 66,675 in Fraser Health, 45,136 in Interior Health, 14,012 in Northern Health, 57,961 in Vancouver Coastal Health, 50,641 on Vancouver Island, 9,820 in the Provincial Health Services Authority. Weekly totals of surgeries completed from January 25th to January 31st was 7,314, or 165 more surgeries than in the same year last year. And we are so appreciative for everyone who's worked on this initiative and who are making this ongoing progress possible and know what it means to families everywhere. This is a significant weekend for many people in British Columbia. The beginning of Lunar New Year celebrations, of course, today. Gangay Fachoy, Shukmung Namoy, to everyone out there. And I want to express my appreciation to the Chinese Canadian community in Vancouver, in Greater Vancouver, in Richmond, and all of the communities across BC, the Vietnamese Canadian community, and many other communities celebrating Lunar New Year, who have been, as communities, extraordinarily committed to following provincial health guidelines, who have been leaders in that regard. And I know that this weekend we are going to celebrate in our communities Lunar New Year's in a way that's safe for everybody, and I appreciate everybody's contribution to that. Sunday, of course, is Valentine's Day and then Family Day, which means that we have to understand the need to operate and to continue to operate differently, consistent with the pandemic, to make this BC Family Household Day long weekend, gathering only with those that you live with. And if we're on our own, it's one or two people we've been with all along. COVID-19 and its variants mean we cannot vary our COVID fighting routine. COVID-19 is all around in BC. You see that in the numbers today. So for us, it's essential travel only. Low risk is where we need to be, and staying local is the way to get there. That means we need to, that until COVID-19 is in the past tense, we must live in the moment and keep using our COVID sense. This weekend, next weekend, and beyond, let's make it a happy and safe Lunar New Year and BC Family Household Day long weekend. Let's use our COVID sense. Let's stop the spread. Let's play our key role in the vaccination plan. And by doing all of that, to save lives together and to celebrate our families, our communities in these extraordinary and important days. Aujourd'hui, nous annonçons 445 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 72 750 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 10 nouveaux décès liés au COVID-19 pour un total de 1288 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 226 personnes sont actuellement hospitalisées, dont 61 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. And a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up as usual this afternoon. And please do not mute your phones. You will not be heard until I call your name. And we begin today with Keith Baldry, Global News.
Oh, hi, Dr. Henry. Just a follow-up on talking about the Moderna situation. Is it the possibility that seniors in long-term care homes who had Moderna on the first dose will not be getting Moderna as the second dose? I know you talked in the past about mixing and matching. I don't think a final decision has been made. I'm just wondering if there's an update on that.
Sure, and that's something that our National Advisory Committee on Immunization has been addressing, as our other immunization committees around the world, and we're looking at that as well. And it is permissive in terms of using the same type of vaccine, so a messenger RNA vaccine can be used, but it is preferable to use the same product that you received the first dose for the second dose. And right now, we're still on track to be able to do that. It may mean that there may be a slight more delay for some people in receiving their second dose of the Moderna vaccine, but we'll be monitoring that as we go and as we find out for sure how much Moderna we're getting when over the coming weeks and into March in particular, because we're still a little bit uncertain of how much is going to be coming when in March. So that is something that we're monitoring very carefully. There is more, we now know a lot more about how to use these vaccines and the effectiveness and the interchangeability, both from what's happening here in Canada and around the world. So we'll be watching that really carefully. I think the other really positive thing is the UK has started a study looking at mixing and matching of not just the same type of vaccine, but looking at whether you can start with a messenger RNA vaccine or start with a viral vector vaccine, the AstraZeneca, and then follow up with a messenger RNA vaccine as a booster dose. And they're also, as part of that study, looking at what the optimal interval might be, whether it's 4 weeks or 6 weeks or 9 weeks, etc. So those are things that we'll be watching very carefully in the coming weeks.
Do you have a follow-up, Keith?
Yes, again on long-term care, I know it's good news that the number of outbreaks has dropped dramatically. Of course, that had been hoped for. Was that anticipated, though? Was there an expectation this would happen this fast?
Oh, absolutely. I think we all were hopeful, especially when we saw how effective these vaccines are in older people. That as soon as we started to see particularly second doses into older people, that protection will last for some time. But I will still say, we've immunized healthcare workers who work in long-term care and had very high uptake, so that's a protective buffer. But we also have maintained the restrictions, so we're not out of that worrisome zone yet. I'll be much more comfortable when everybody in long-term care has their second doses, and then we can allow more people in. So that will be happening soon.
Thank you. The next question comes from Justine Hunter, Globe and Mail.
Thank you. For Dr. Henry first, Mr. Dix just talked about that point in time when we can refer to COVID-19 in the past tense. And I think there's an expectation perhaps that point comes once we've all had our vaccines, and I'm wondering if that's realistic. So could you talk a little bit about what you think we should be preparing for with these variants? Will vaccines and other measures likely be needed in the long haul?
Wow. I wish I knew the answer to that. Simple questions. You know what? I believe that this pandemic will be slowed and stopped by our immunization programs. As long, we're in such a tricky place right now because we don't yet know the impact of these variants. We are monitoring carefully, and the point prevalence that I mentioned that was done by our laboratory colleagues this week, that gives us some reassurance that we're not seeing a lot of transmission. But it only takes a few introductions for it to take off. We know that this virus, we talk about the reproductive number as an average, but most people don't spread to anybody, but there's some people who spread it to large numbers of people. So that's, what we're trying to affect. To protect people from, with the measures that we have in place, the public health measures about not coming together in large groups, particularly indoors with poor ventilation, etc. So I do believe that if we can get through this next few weeks and get our immunization program up and running, protect people, and then once we have a lot of vaccine, which should, more and more likely that we're going to be able to immunize larger numbers of people by the summer, I think we'll be in a very different place. We will get back to small gatherings. But we don't yet know how long the protection from each individual vaccine series is going to last. There's a possibility that we might need boosters at some point in the future, and that's why I think it's important for us to start planning for altering vaccines. And the messenger RNA vaccines are ones that can be changed fairly easily and be more effective. But whether that's going to be yearly, like we see with influenza, or whether that might be periodically every 3 to 5 years or whatever, we don't yet know that. That's a possibility. I think the way this virus has been shown to change, the mutations are slower than what we see with influenza and some of the other respiratory viruses. I think there's a growing sense from most of us that we're going to see it as a recurring respiratory virus in the respiratory season, so fall and winter for us over the coming years. But whether we have enough immunity that it's not going to cause these explosive outbreaks and lead to hospitalization and overwhelming of healthcare systems as we've seen in this past year. We hope that that's not going to happen, that things will settle down as immunity increases. And it may change to become a more benign respiratory virus like we've seen with some of the other coronaviruses over the years.
Thank you. Justine, do you have a follow-up?
Yes, I do. Thank you for that, Dr. Henry. Minister Dix, Premier Pallister is going to buy vaccine for Manitobans. It won't likely come before the end of the year, but at least we'll have a Canadian company on its feet that can manufacture vaccine. And it sounds from Dr. Henry's answer that that's probably a good idea in the long term. Wondering what you're doing, what BC is doing to ensure that Canadians and British Columbians will have some domestic capacity so we don't end up in the same bind again in the future?
Well, first of all, just in all aspects of COVID-19, there's enormous research effort going on right here in British Columbia. We want to appreciate the work done at the BC CDC, the work supported by the Michael Smith Foundation, by Genome BC, by the Academic Health Sciences Network, and so on. There are more than 600 research projects underway. So a lot of work just understanding what we've been through, but also ensuring that we learn the lessons from a health perspective, from a social perspective of COVID-19. We're very interested to see what happened in Manitoba, the agreement announced in Manitoba. Certainly, we're interested in anything in the long run that would create stronger domestic capacity. And I know that Dr. Henry and I believe, will be meeting with the company in question as well on that question to take a look at that. But right now, it should be said, we're focusing on the immunization of 4.3 million British Columbians. This is our top priority. This coming week, we have 55,000 doses coming in of Pfizer. We're not sure at what point during the week. So ensuring that our acute care settings are safe, that we're reaching out to people in community health will be the priority in the coming week. And then led by Dr. Ballum with enormous amount of support across the country, delivering not one, but essentially 2 doses, we believe, to 4.3 million British Columbians. So we're really focused on doing that and doing that well. And it's going to be an extraordinary thing that's going to involve everyone in BC. But on what happened in Manitoba, that's something obviously we need to look at, because the COVID-19 pandemic is at a critical point now. 400 to 500 cases, but cases coming down in long-term care, somewhat lower levels of hospitalization, and vaccines on the horizon, but still the absolute need right now for all of us to focus on stopping transmission and following public health guidance, which is more important now, or as important at least, as it has ever been since the beginning of the pandemic. So that's the position we're in now, but we also have to prepare for the future, and interested in what Manitoba has done, and we're obviously doing some work, a lot of work in BC at every level to ensure that that we prepare ourselves not just for the immediate and the now, but for the years to come.
Thank you. The next question comes from Miriam Bethlehem, News 1130.
Hi, Dr. Henry. Thank you so much for taking my question. I've got a question about workplace gatherings, specifically to celebrate Lunar New Year. We got a tip about an office in downtown Vancouver organizing a Lunar New Year meal in the office. They seem to think it's fine because there'll be distancing and servers will be wearing masks, although this is breaching COVID rules. There may be happening in multiple workplaces. What's your reaction to this? People gathering outside of their core bubbles.
All gatherings right now are risky. And these are not within the guidance that we have. Workplaces need to have their COVID safety plans, and they need to adhere to them. There are ways of having gatherings with your workmates, with your family, with your friends that are not risky. And I know that as people are doing for certain meetings, for example, they have a small number of people in the room and others participating virtually. So those are the things you need to do through this Lunar New Year. And if workers are concerned about risk, they can contact WorkSafe BC. There's some advertisements that have been putting out, and then the number to contact. There is a hotline there where you can get advice from WorkSafe BC about your concerns around the workplace.
Follow-up, Miriam?
Yeah, and Dr. Henry, as you know, a number of COVID-19...
Just one further thing on that. If people are thinking of doing a gathering that breaches COVID rules this week, in Vancouver Coastal Health, there was 135 new cases announced today. And people are planning that. Our message, I think Dr. Henry said it, I want to say it really plainly, is don't do it. This is not the time. This is a particularly important time for COVID-19. And if you're thinking of something that you're concerned is past the line, there's a really simple answer to it. Don't do it. Don't do it this weekend. Don't do it right now. And that message should go to everybody.
You can ask your follow-up now, Miriam.
Thank you. And as you know, a number of cases at schools in the North Shore, maybe linked to social gatherings between students that happened over the weekend. We're also hearing about kids gathering in large groups on the beach or groups of 6 who are not in the same household going out for dinner. I mean, do you have any suggestions to parents who may not know that their kids are doing this, or for parents who are, allowing this to happen?
Yeah, so, again, we know that this has been hard on young people, and young people by nature are social. So yes, these are conversations to have with your children. We also know that the young people in my life, they care about their families, they care about their communities, and they want to do the right thing. So we need, as a community, to support them in being able to do the right thing. There's sometimes a lot of pressure on young people, and it's hard for them to know how to react and how to say no to things. So this is a time where it is important and okay for you to say no for going out with your friends right now. It's not okay to go in a group and go up and spend the weekend at Whistler. It's not okay to go out and party with your group right now, because that's putting your family, your community at risk. And there will be a time for this. There will be a time when we'll be able to get back together again. We'll be able to hang out with our friends, and it'll be exciting and fun and new. But this is not that time.
The next question comes from Katie DeRosa, Vancouver Sun.
Hi, Dr. Henry. Thank you for taking my question. I'm just following up on what you're talking about in terms of possible higher herd immunity needed with the variants of concern. And what does that mean for long-term care when, last week you said 89% of long-term care staff have received the first dose and 87% of residents. But if all the long-term care staff have been offered the vaccine, and so there's perhaps 11 or so percent who either can't get it for medical reasons or have turned it down. Is that 11%, acceptable to you, given these perhaps the higher herd immunity needed with these variants of concerns?
Yeah, so I think we're talking about two different concepts here, and part of that is, how many people does around you need to be protected to make sure that that person who's not immunized is protected too, and what I call community immunity, and we use the term herd immunity, although I don't like that one quite so much. But that's about how this virus can propagate in our society and communities around the world. When we look at long-term care homes right now, they are a community of themselves, and having immunization rates, the protection rates that are that high, means that they have achieved that herd immunity in most cases in long-term care. So if there's a small number of people who are not immunized, and if it's a healthcare worker and they do become infected, the chances of them passing it on to any of the residents is now much, much lower, because the residents themselves are protected. So we have achieved that, and we're seeing that now in the decreased rates that we're seeing in long-term care. But we're not at the point yet where everybody's had their second dose, which gives us longer lasting immunity. We know that. We still don't know how long that is yet, but that's what we need to make sure that we're protecting that little community for as long as possible, as well as possible. So it is really on an individual basis, and I'm hoping next week we'll have some details to share on that about how we're monitoring the vaccine effectiveness and the protection that we're getting in places like long-term care here in BC.
Do you have a follow-up, Katie?
Yes, and as a follow-up about the one the one variant of concern from Nigeria, can you say which health district that person is in, whether they're self-isolating, and also, I mean, this is a secondary, but will the province release regular variant numbers so that we can see what's happening with the variants of concern?
Yeah, so I've been releasing them weekly, actually twice this week, but we will be updating those on a weekly basis as we continue our surveillance. And I just reported them again today. Usually I do that on Mondays, but reported it today because we're off till Tuesday, and I also wanted to give the results of the point prevalence. But yes, the new variant under investigation, there's another term for us to use, is this one associated with Nigeria, was a young person who's in the interior health region who returned from travel to Nigeria and it has been isolating, and there's no transmission that we're aware of from that person, and public health is following up and the investigation continues.
Thank you. And the next question comes from Bhinder Sajjan, CTV.
Hi, Dr. Henry. I'm just wondering, with regards to all of these variant cases, are they individual cases or is there a potential cluster of cases anywhere?
Yeah, there's been a couple of both. So I can tell you that has some details. Of the 29 cases that are associated with the B117, the UK variant, all but one were either directly related to travel or somebody who was a close contact of somebody who traveled, or has been a confirmed case, so a cluster in the community that was known, and then in retrospect was found to be associated with this variant. As you know, we've only started looking for the variants quite recently, so a number of these cases had already been past their infectious period when we found them, so the investigation identified other people that were involved in their cluster. So there have been a couple of those associated with the UK variant. With the 17 that we've seen that have been associated with the South African variant, again, there are a few that are travel related, but the majority are actually part of a cluster locally. Again, that's been investigated, and we've not seen ongoing transmission once we've identified the case, but we have retrospectively identified people that that person also was in contact with. And there's a couple, though, that we do not yet know how they acquired it or where they acquired it from in the community. So two in particular of the South African variant that are concerning, although what we do know is they have not passed it on to others. So there are 3 active cases so far. The rest of them are all retrospective cases or people who've been beyond their infectious period.
Follow-up, Bhinder?
I do. Just given the prevalence test that you spoke about, what is your estimate of the total number of variant cases that could potentially be out there in British Columbia right now?
Yeah, good question. I didn't do that math before I came out here, but what we have found is 0.1% of the positive cases that we did in this point prevalence over that 5-day period were confirmed to be a variant. So that's a very small number. So if we have 4,000 active cases, we're talking about maybe 4 or 5 additional people with potentially with a variant in the community right now. So we'll continue to do these point prevalence studies periodically to see if that's increasing. We'll also be continuing to do targeted surveillance. But you know, the good news is that right now, with those 3,099 cases that were screened and the whole genome sequencing was done, it was 0.1% that we're seeing right now.
Thank you. The next question comes from Richard Zussman, Global News.
Dr. Henry, I'd like to ask you, if churches were able to put in the same safety protocols as bars, restaurants, and health clubs, what is it about churches or other religious gathering points that still make them more of a public health threat for the spread of the virus?
Yeah, so I think we need to look back on what we were seeing, and this is something that's not unique to this pandemic. We've seen it with other outbreaks as well, that the nature of the interaction, the social interaction that you have with a faith group is fundamentally different than some of the transactional relationships we have if we're going to a store or even going to, an individual working out in a gym, an individual going to a restaurant or with your small group of people. Having said that, we engaged very early with faith leaders across this province, and they recognize the important role that they play. I just want to reiterate, we know how important, essential faith services are for people and for communities across BC, and that's why we've been working with faith community leaders since March of last year. And we stopped all of those types of interactions when we were learning about this virus and what was happening with this virus and how it was transmitted and what situations it was being transmitted last March. And then when we reopened gatherings, and particularly faith gatherings, we did talk with the community about what were the things that made it safer. And those measures were in place. We limited numbers, we had spacing, we introduced masks when that was needed. We talked about the different things that happen in different, whether it's a church or a gurdwara or a temple or a synagogue, and tried to make rational approaches that would support people. We also know that there's a demographic that goes to many faith services and that is older and more at risk in some cases. So we needed to take that into account. And we were able to allow and to have active in-person services through most of the summer and into the fall. As with many other things, as we got into the respiratory season, we saw the transmissibility of the virus increasing. And what we were seeing was that there was transmission in a number of faith settings despite having those measures in place. So that spoke to us about there was something about those interactions that meant that the measures that we thought were working were no longer good enough to prevent transmission of the virus in its highly transmissible state during the winter respiratory season. And so it was because of that we put in additional measures to stop the in-person services starting at the end of November. It really was because we were seeing, despite people taking their best precautions, we were still seeing transmission. We were seeing people ending up in hospital, and sadly, we had some deaths in particularly older people who were exposed in their faith settings. I want to get back, and I've been talking with the faith leaders as soon as we can. Once we're out of that danger zone, once we understand what's happening with these variants, once we get our community levels low enough that it's not that risk anymore, then absolutely we will be going back to those safety precautions that we know work.
Follow-up, Richard?
You've mentioned over the last week a lot about Lunar New Year and Family Day, but there hasn't been a lot of mention about Valentine's Day. I know all social gatherings, there's restrictions on everything, I get that, but is there not any specific concerns associated with the way that people typically gather and celebrate on Valentine's Day?
Well, I will tell you that this is hearkening back to last year, but we have had some discussions with the restaurant and the food and beverage industry about Valentine's Day and about some of the concerns, but it's a fundamentally different vibe to Valentine's Day. It's generally couples, families, young people together, small groups. It's not a party in the same way that for the Super Bowl or, some of those events are. But again, we know this virus is transmitted when we have close contact with people. And this is a time to have close contact, to enjoy your Valentine's Day with your sweetheart, your loved one, and keep it small.
Thank you. And the next question comes from Moira Witten, the Tyee.
Hi, thank you so much, Dr. Henry, for taking my question. My question is about low prevalence of variants that the data you cited today is showing in BC. With Alberta, our neighbor, our border sharing province, reporting, I believe, in the hundreds or 200s of cases of variants, are you concerned that we could see importation of those potentially more transmissible variants into BC?
Absolutely, and not only from Alberta, from Ontario. There's a considerably higher rate in some areas of Ontario as well, and we know that there's still travel back and forth. It comes back to, the fundamental thing that we know about this virus. It's transmitted between people, and when we inadvertently or not, when we travel, we take the risk that we have with us and we pick up the risk from where we're going and bring it home with us. So it is people moving that spreads this virus, including the variants. And I've also said a few times, we know that the more transmission you have, the more cases there are, the more opportunities there are for the virus to change, for a mutation to happen as it replicates. So it's not surprising to me that we started to see the variants arise in countries that were having a lot of transmission in some communities, and then, of course, it takes off. So that's what we're concerned about right now. We're coming down, but we're at a fairly high level still. We had over 200 cases just in Fraser Health, and it's a large population in the Fraser Health region. We've started to see a little bit of an uptick there. That's where we need to be careful, because it can change so rapidly and it grows exponentially when we start to let our guard down. So that's one of the reasons why it's so important to stay small, so that we don't give the virus a chance to spread and to replicate in many more people, and we don't travel right now.
Follow-up, Moira?
Yes, thank you. I've heard from a number of cleaning staff, porting staff in hospitals around Vancouver particularly, but around the province, that they're concerned that they haven't been vaccinated in a lot of cases when they're coming into contact and regularly serving as a vector between wards in our healthcare facilities, while management and people with more office-facing jobs have been. Is it your intention that these staff would be included in the current phase 2 vaccination rollout, and why would they not be vaccinated before or at the same time as management?
Okay, so there's a couple of things. One, we're in phase 1 still, and phase 1 focuses on healthcare workers who have patient contact in particular wards, and that is really important. Those are the people who are being immunized first, and so management, cleaning staff, others are not in that priority group. We know that there are some nurse managers, for example, who I know some of the people who've been immunized are people who work in help with the outbreak management in long-term care homes, things like that. So we don't always know the reason why an individual may have received the vaccine, but we also have to remember there are other things in place. We've had limited amount of vaccine, so we're focusing on those people who have a direct patient contact, and particularly in the highest risk areas in hospitals right now. So the focus has been in the last little while in emergency departments, ICU, the medical and surgical wards, to keep the hospital running. And the primary focus has been on people with patient contact. We have other things in place that protect other workers, including cleaners, people who work in food services, security, all of the essential workers that we have in our hospital system. And yes, it is important, and they are in the next phases of our immunization program. But with the limited vaccine, we're focusing on people who have direct patient contact, and we're making sure that things like access to personal protective equipment, the fact that cleaners don't go into the room with an active case unless they have the certain precautions and protections in place. So there are many other things that keep people safe in the system that need to continue, and we've said that many times. We need to continue doing what we're doing in the hospital system, in long-term care, until we have enough vaccine to protect everybody.
Thank you, Dr. Henry. And we have time for one more question this afternoon. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. And the last question this afternoon comes from Susie De Silva, CBC.
Thank you very much. Dr. Henry, we've heard from people who are in mandatory isolation right now who are shocked to find out from their contact tracer that they're allowed to take their dog for a walk, even if they have COVID. The BC CDC's website doesn't specifically mention walks or answer other specific questions about isolation, like whether someone can use their building elevator to take out the garbage, or if someone can get something from their car in the parkade. How can people in quarantine find out some of the answers to these specific questions like these, and why is it not more clear?
Okay, I thought it was quite clear, but there is the person that you're connecting with from the health authority for people who are in quarantine, who are a case of COVID. So it depends a little bit if you're somebody who's sick with the virus or somebody who's a contact and not sick. And yes, there are some things that we allow people to do, going outside. If you are in a house and you don't have any contact with anybody else, you can go into your backyard. We know that sometimes people need to get supplies, and we try and support them to be able to do that without having to go themselves. So there are many things that we do to try and support people to be able to quarantine safely and to isolate safely.
Do you have a follow-up, Susie?
I do. This is just about folks who already have had COVID. Do you plan on giving one dose of the vaccine to people who've already had COVID?
Yeah, good question. The jury is still out on that. We've seen now that people who've had COVID, particularly if it's been within the 3 months or so, they get a nice booster response from their first dose of vaccine, so they would not necessarily be a priority for getting a second dose right away, particularly in a time where we have a shortage of vaccine. So that's something that we'll continue to monitor. But yes, right now we are still intending on giving everybody a second dose because that's the way the vaccine program is designed, and whether it means that we can wait a bit longer for people who are getting a boost from natural infection as well.
Thank you very much. And that's all the time we have this afternoon.
Thank you.
Have a good afternoon.